Well, it's a condition doctors say affects 60 to 80% of women. We're talking about uterine fibroids. And this morning's STL Moms Report, Fox 2's Molly Rose is talking with a doctor who says it's not talked about enough.
Yeah, Randy, this morning we are talking with Dr. Keith Pereira with SLUCare so we can learn some more about this. Doctor, thanks for being with us this morning.
Thank you for having me.
And you mentioned this is something as a topic that's not discussed enough, and there's people who probably have a lot to learn about it. What are some of the side effects that someone might know if they're suffering from this?
So fibroids is, I call it a common problem that's uncommonly spoken about. 2 in every 3 women have fibroids actually. And some of the symptoms that you can see are difficulty with menstruation, so increased bleeding, clots during bleeding, bleeding between your menstrual periods, and then you're talking about pain and pressure in your lower belly, sometimes even increased urination, you need to go to the bathroom very often, constipation, and sometimes even back pain. So all these symptoms constitute fibroids, which is a non-cancerous growth of the uterus that results in the uterus getting enlarged and causing all the symptoms.
It sounds kind of scary when you talk about it. Is it actually dangerous, or is it just bothersome if you're dealing with it?
I think you nailed it. It is not dangerous. This is not cancer. You cannot die from fibroids, but it is bothersome. It affects the quality of life. It affects your work, getting to work every day. And affects, these fibroids do affect people of childbearing age. And so it affects how you take care of your kids. Because if you're suffering, you will not be able to take care of your kids as well.
And this can be one of those topics people might be nervous or embarrassed to talk about with their doctor, but like you mentioned, it's super common. So speak up if you're having concerns about this.
Yes, I think I think you need to stop coping with fibroids. You need to seek help, seek options, because there are treatment options now. Talking about menstrual periods and stuff still remains a taboo in a lot of our societies. Many women have dealt with it; they suffer in silence. And their moms have dealt with it, and the grandmoms have dealt with it, and so they think that this is something we have to live with. And no, I think in 2021 things have changed, and we need to seek help for these treatments.
Yeah, I agree. I'm glad we're talking about it today, and we're talking about some treatment options as well. Some of those not even that invasive, right? Tell us about the different options out there.
Yeah, I think you start with mild symptoms. You have medical treatment. You get iron medications. You get hormonal pills, and then the more dramatic option when things get very bad is hysterectomy, which is removal of the uterus or a portion of the uterus. Now there are a lot of minimally invasive options available. These are non-surgical options, and what I'm talking about is called uterine fibroid embolization. It sounds like a complex medical jargon, but the simple thing is we block the blood flow to the fibroids and cause the fibroids to shrink without even having to take out the uterus. And so it remains a little bit of a best-kept secret in fibroid treatment, but it's now getting more and more popular. Yeah.
And is there a certain age group that are impacted by this more than others?
Yes, unfortunately, fibroids affect women more in childbearing age in the 30s and 40s. That's the most common age. And that's where you're active in your life, you're dealing with kids, you're dealing with work. It becomes very stressful, and it does affect a lot of people, mentally.
This is good information, doctor, and I hope it encouraged anyone at home that might be dealing with this. Just talk to your doctor. Don't be embarrassed about it. Speak up and definitely get some help. So thank you for all the information.
Oh, thank you.
For joining us this morning.